Aesthetic Crown Lengthening. This is the first of a series of animated videos on aesthetic crown lengthening. This is part one, the background and the benefits of this procedure. Aesthetic crown lengthening, in my opinion, is the most overlooked aesthetic procedure in dentistry. It's impossible, in my opinion, to present these cases without pictures, because a picture is worth 1,000 words. It's emotionally gratifying for both the patient and the surgeon, and is most effective when it is approached in an interdisciplinary fashion. For example, the orthodontist needs to take pictures, explain to the patient what needs to be done before sending the patient to the periodontist. What do you hope to accomplish with aesthetic crown lengthening? Certainly, we are expecting to get smile enhancement, but also we get facial enhancement, and that is one of the things that this particular video is going to emphasize. And finally, the psychological enhancement. For this is often done on adolescent females who are somewhat introverted, and all of a sudden, when they appear to have real teeth rather than baby teeth, they just come out of the shell. And this is one of the most exciting things I find in doing this procedure. Let's talk about what is a gummy smile. It means a portion of the anatomic crown remains covered with gingiva. Could be altered, passive, or delayed eruption, showing how much gingiva represents a gummy smile. I think Vince Kokic's son published this article in 1999, and what he did on this case, it was very innovative for the time. He created a series of gummy smiles, and then he showed those to an orthodontist. And those smiles that showed 2 millimeters of gingiva, the orthodontist perceived that as a gummy smile. However, those that just showed 2 millimeters, the general dentist did not perceive that as a gummy smile, but they had to show 3 millimeters before the general dentist recognized this or felt it was a gummy smile. And finally, the patient did not perceive this as a gummy smile until they showed 4 millimeters. And this was a very liberating article for me, because at the time I hesitated to do crown lengthening if I could not get rid of all the gummy smile. But if you've got a patient showing 4 millimeters and you can reduce that and only show 2 millimeters and have a much better gingival architecture, the patient is satisfied. And we need to keep in mind, when we do procedures, we're not treating to our aesthetic goal. We're treating it to what the patient feels is aesthetic. But what's missing? No one showed this to the periodontist, because I can tell you, if you show it to a periodontist and they show any gingiva on the central incisors, we're going to perceive that as a gummy smile. You can't always get rid of a gummy smile. Look at this gummy smile, and went in there and removed part of it. I'm sorry this is a little cloudy, but notice the difference in the contour of the gingiva. And the patient was extremely satisfied with the result, although we did not get completely rid of the gummy smile. So remember what I said, we're treating the patient satisfaction aesthetically, not to our satisfaction. Now, people with a gummy smile tend to posture their lips, and although this is not exactly a gummy smile, let's see what we're talking about. Therefore, with the patients with a gummy smile tend to not smile, or to posture their lips the way this patient does. Here you see the Cupid's bow, how pronounced it is, and when we look on the right, we see what the patient is trying to hide. They do exactly the same thing with a gummy smile. Periodontal plastic surgery creates the framework for the perfect smile. Yes, we see a gummy smile on this patient, but also look how prominent the canine is. And that was the focal point. The patient did not realize that the gummy smile was vitally involved in this. So when the periodontist alters the bone and soft tissue contours, then the beautiful work of the restorative dentist becomes the focal point. So let's look at a combination of crown lengthening, veneers, and the aesthetics created in this particular case. And also, would you note the fullness of the lip? No Botox was done. But on the left, we see how tense the lips are and on the right, when the patient is pleased with the smile, how the lips relax and look fuller. Smile enhancement leads to facial enhancement. Here we see this lady, we see the wrinkles there, and look at the eyes compared with the eyes on this one. Sorry this is a little bit blurry, but one of the things that I've found on adult patients, when they have this done, not only do they get psychological enhancement, but the hairstyle of the women almost invariably change. If nothing else, the color will change. But look how the wrinkles are gone on this particular patient. It hardly looks like the same one. And this is facial enhancement. Notice about this smile. This is post-crown lengthening. In this particular case, we only did crown lengthening on the 6 anteriors. And look what happened. We have no tooth showing in the back. So therefore, the smile lacks depth and appears that he has no posterior teeth. If you place your finger on your lip and smile, you will notice that the lip does not elevate over the central incisors, but the buccal corridor shows. So if you're going to do crown lengthening, you typically have to go from the mesiobuccal cusp of one first molar to the other first molar. Why do I say the buccal cusp? Because the way the tooth is canted, the distal of the first molar does not show. Smile enhancement, as you see here, also leads to facial enhancement. Notice how she's posturing her lips. She's obviously trying to hide something on one side. What do we note on this patient? First of all, look how tense that smile is, how thin the lips are, and how she is saying, okay, you want to take a picture? Here, I'll smile for you. But then after aesthetic crown lengthening is done, what do we see here? Look at the fullness of the lips. Look how she's posturing the lips. But one thing I want you to note is look at the buccal cusps and the incisal edge, that dark area there that I'm pointing out here. This points out a very important thing. If you're going to do aesthetic crown lengthening, do not bleach the teeth before the crown lengthening, but do that as a separate procedure. Same young lady, look at the facial enhancement. Look at the eyes, how tense. Again, look at the way she looks. This is a pleased, happy, self-confident young lady. Smile enhancement leads to facial enhancement and a psychological enhancement. And one of the most satisfying things in doing aesthetic crown lengthening is a psychological enhancement. The benefits of psychological enhancement. Number one, the patient is much more relaxed after this is done. They're much more outgoing. They have a higher self-esteem, and they're less introverted. Now, look at this patient. Look at those eyes. What are they saying? I don't understand what you want. You want me to smile? And obviously, on the left side of the slide, you can see how she is positioning her lip. Obviously, there's something that she wants to hide there. So we went in and did aesthetic crown lengthening, followed by some veneers, and can you believe that this is the same patient? Especially look at the eyes, how relaxed the eyes are on the right, and as we said earlier, women tend to change their hairdo or at least change their hairstyle. This is one happy patient, and look at the contour of the upper lip and the lower lip, fuller as we pointed out before, and she is so pleased. Look how big she smiles. A very satisfied and happy patient. Hopefully, I have demonstrated the importance of aesthetic crown lengthening and the impact it can have not only on the smile, but on the face, but the psychological enhancement. Use and enjoy.